Good afternoon, everyone. My name is Lester Ferrer, and I am currently one of the emergency department managers at Kaiser Permanente Medical Center. Is located in Santa Clara, California. And today I'm going to be talking about our strategic plan to improve patient admissions. So Kaiser Permanente's vision: we are a trusted in total health, collaborating with people to help them thrive and create communities that are among the healthiest in the nation. So to kind of expand on that, our patients are the center of our business model, and quality and care are priority during their time here when they're seeking medical treatment, and at most times admitted to the hospital. So again, we'll continue with the next preceding slides. So what the strategic goal entails of is accelerating the patient admissions to reduce hospital overcrowding. And I'll go into more detail of that in the next couple of slides. Second goal is to reduce unnecessary hospital admissions by appropriately placing patients in the right care and recovery environment. So not every patient that comes to the medical facility necessarily needs to be admitted to the hospital. So having a more effective and efficient screening process during the couple of hours that they are here to be seen. And lastly, our ultimate goal is to achieve a lead time of 60 minutes from the time an admission order is received to the time a patient leaves the emergency department. So that's going to be our focus here. So all adult patients that enter into the emergency department who meet the admission criteria and aren't necessarily going to be discharged from the hospital, the goal is, once an admission order is received by the admitting doctor, the emergency department will have 60 minutes to admit that patient and transfer them out to the nursing unit that they are going to eventually be watched. So here's a graph of what our current state is. For the 2018 performance metrics, this all starts here from May 2017 all the way up to last year, about October 2018. And the medical organization's target is 80% of our patients being admitted within that 60-minute time frame that I discussed at the last slide. And the line that goes from month to month shows that we've averaged only about 40% of that amount, and so that's about half of what we're meeting with the current goal right now. And again, I'll be explaining these in the preceding slides. So what we identified is the efficiency of registered nursing handoff. So why do we care? I'm going to go ahead and read off of this slide here. So the issue of handoffs has become so prominent that the Joint Commission introduced a national patient safety goal specific to handoffs that have become effective as of January of 2006. The Joint Commission requires healthcare organizations to implement a standard approach to handoff communications. Improving patient handoff is a patient safety goal and one of the top 5 World Health Organization priorities. So like you see, this is of global importance. And inadequate communication handovers have been identified as the primary root cause of sentinel events. So not only does inefficient admissions affect the efficiency of care, but also the quality. So those are just some of the sources that prove that. So problems with handoffs today, just a couple of points that I do want to make. Handoff communication errors contribute to adverse patient events and outcomes. As I said, quality is affected. A handoff is largely dependent on the interpersonal communication skills, knowledge, experience level of the caregiver. So in the emergency department alone, we have about 200 staff members. About 75% of that are registered nurses who give report to the hospital side, where there is even more staff, and within each individual is each different style of communication. So everyone can kind of see how there could be inconsistencies with that process. There's also a variability in the quality of lack of structure and variances in shift handoffs, like I was discussing. And research indicates that only 8% of schools teach how to hand off patients in a formal didactic sessions, a large educational gap in new professionals. And what I can remember from being in nursing school is we focused on patient care and skills, not so much with the actual handoff portion of it. And that's usually learned on the job. As you advance in your career, someone will typically get better at it. But again, that's very dependent on each individual nurse. So one more slide here. Ineffective handoffs can contribute to gaps in patient care, so delays, breaches, failures in patient safety, medication errors, wrong site surgery, or even death. So how can we solve this problem? As you can see here, these are actually staff members that have worked on this problem, from hospital leaders, physicians, quality analysts, even housekeeping, and some other units that are non-nursing, that are all involved in the admission process. So how we propose for the strategic plan is to center the model on electronic handoff, because electronic handoff is a template, and this is in its rough incarnation, can add value, add consistency, and minimize the amount of gaps in information that is passed from one clinician to another. So the functional level action plan, we are going to utilize a cross-functional team, including representatives from all stakeholders, that will develop a process with the electronic note to center for the center of the model. So again, the focus is going to be on this electronic note, and like I mentioned in 2 slides ago, it's going to be contributed by multiple stakeholders. Again, different clinicians, different units, different departments. All the stakeholders involved in the admission process will add to this. And like I said, some of the stakeholders are listed here. Again, it'll be ED and emergency department and floor nurses, assistant nurse managers, medical center leadership, analysts, patient progression supervisors, which are also known as our nursing house supervisors that coordinate care from the emergency department to the inpatient side, housekeeping, and social work and PCC. So they're the ones that, so the last 2 particular groups are the ones that are going to screen whether a patient meets admission criteria or can be discharged to, say, a skilled nursing facility or a long-term rehab. They don't necessarily need to be in the hospital. Communication plan. So the strategic plan is going to utilize Cotter's 8-step model, specifically steps 6, 7, and 8. So 6 would be the stakeholder empowerment. So the ability to have a say and have a voice in the process. So we're talking about staff nurses in particular that can contribute to improving the electronic note. The 7th step would be all communication platforms will be utilized. So how we're going to communicate this with every single stakeholder is through various platforms like posters and email, shift huddles, one-to-ones with the direct managers, and that process will be ongoing even when the medical center acquires new staff. And then the last step in that process would be promotion of small wins. So to sustain momentum, obviously, this is going to be a collaborative effort. And not only do we want to identify problems during the first part of the launch of this initiative, but also we want to celebrate wins, because that's going to not only sustain momentum, but also recognize our valued stakeholders who have hands-on experience and are actually carrying out the process during the admission, the patient admission. And what we're going to use is the feedback control model. All members will be trained on the process. Training plan will be integrated with existing new employee orientation plan. So again, this is not going to stop with the orientation and the education. And then last, frequent monitoring will be done by department leaders such as myself. So every month, every week, even on a daily basis, we'll try to identify opportunities, try to troubleshoot them real time, and looking at retrospective data. We will analyze behaviors, patterns, things that may be barriers to the new electronic note process that maybe we can enhance, and also get feedback from our direct stakeholders. So I'll allow time for any questions that anyone may have. And if not, thank you very much for your time.